Okay, big news today. We are diving into something huge happening with Ozempic and Wegovy access.
Yeah, really significant. We're talking about a new partnership making these drugs available through a major warehouse retailer.
Exactly. We're going to break down the price, who actually qualifies for these, and the really important health stuff you need to know.
Mm-hmm.
So the headline is, starting now, Costco members with a valid prescription can potentially get these medications there.
And the number everyone's looking at is the price. $499 for a 1-month supply. That applies to both Ozempic and Wegovy through this program.
Wow, okay, so $499, that feels like a massive drop, especially when you hear about people paying, what, $1,200, maybe $1,300 a month without insurance?
It absolutely is a big difference from those out-of-pocket costs. Cuts it roughly in half.
But is that price exclusive to them? Or is there more to it?
Well, that's an important clarification. That $499 price point isn't unique just to Costco. Novo Nordisk, the maker, actually offers that price point directly and, through other big pharmacies too, like CVS and Walmart.
Ah, okay, so the price itself is standardized. What makes the Costco thing interesting then?
I think there are a couple of things. First, for their executive members, if they use the Costco Citibank card, there's that extra 2% reward back. Small perk, but on a $500 purchase, maybe it adds up for some.
Right, a little bonus.
But I think the bigger deal here is trust and perceived safety. People worry about counterfeit drugs, especially injectable pens bought online. The FDA warns about this constantly.
That's true. You hear horror stories.
So getting it from a huge established retailer like Costco provides a layer of, confidence. You feel safer about the source.
That makes a lot of sense, a trusted channel. Okay, let's shift gears a bit, because people often lump Ozempic and Wegovy together, but they're not the same thing at all, are they?
No, definitely not interchangeable. And this is critical. Ozempic is specifically FDA approved for adults with type 2 diabetes. Its primary goals are lowering blood sugar and, importantly, reducing the risk of major cardiovascular events like heart attack or stroke in those patients.
Okay, type 2 diabetes focus for Ozempic. What about Wegovy?
Wegovy uses the same active ingredient, semaglutide, but at a different dose. And it's FDA approved specifically for chronic weight management.
So for adults who are classified as overweight or obese?
Exactly. And usually they need to have at least one weight-related condition, like high blood pressure, high cholesterol, or type 2 diabetes, to qualify for Wegovy.
And didn't Wegovy also get a recent nod for heart health too?
Yes, that was a big development. It's now also approved to reduce the risk of heart attack or stroke in adults with cardiovascular disease who are also overweight or obese. So it's expanding its role beyond just weight loss.
Got it. But no matter which drug, you absolutely need a doctor involved, right? These aren't over the counter.
100%. A doctor must evaluate you and write a prescription. These are serious medications with potential side effects and risks.
Let's talk about those risks. What should people know?
Well, the most common side effects, especially when starting, are gastrointestinal things like nausea, vomiting, diarrhea, constipation. That's because of how the drug works, slowing down digestion.
Makes sense. Anything more serious?
Yes. There's an FDA warning about a rare risk of thyroid tumors, specifically medullary thyroid carcinoma. So anyone with a personal or family history of that specific cancer should absolutely not take these drugs.
Okay, that's a crucial exclusion.
There are also less common but serious risks like pancreatitis, gallbladder problems, kidney issues, and potentially vision changes. And a really important point for diabetics using Ozempic or even Wegovy sometimes. Your doctor likely needs to adjust your other diabetes medications, particularly insulin or drugs like sulfonylureas, to prevent your blood sugar from dropping too low, which can be dangerous.
Okay, so careful monitoring and doctor oversight are key. Now back to the access part. The price is down to $499, which is great for many, but what's the catch? Is everyone who qualifies going to be able to just walk in and get it?
Yeah, that's the million-dollar question, isn't it? Or, well, the $499 question. The biggest hurdle remains supply.
The shortages we keep hearing about.
Exactly. Demand for these drugs is astronomical, way higher than the current manufacturing capacity. So even with this Costco partnership, they can only dispense what they actually have in stock.
So just because it's available doesn't mean it's actually available when you show up.
Precisely. It's a nationwide issue. Pharmacies everywhere are struggling to keep these on the shelves consistently. Availability is not guaranteed.
So for you listening, the practical advice here is what?
Talk to your doctor first. That's step one. See if you even qualify, discuss the risks and benefits for you, and get that prescription if it's appropriate.
And then?
And then, before you head out, call your local pharmacy, whether it's Costco or somewhere else, to check if they physically have the medication in stock. Don't assume it'll be there.
Right. Manage expectations on availability.
Absolutely. So, summing up, this price standardization, bringing it down from that potential $1,300 level, is a major step for affordability, especially for the uninsured. That's undeniable relief.
Oh, but.
But the lingering thought is this. We've lowered the financial barrier significantly, which is great. But if the sheer demand continues to swamp the national supply, does a lower price tag truly equal better access for the average person who needs it? If the shelves are often empty, how accessible is it really? Something to think about.